is Dr. Maurie Markman, and I'm going to briefly be discussing a very interesting paper that appeared in the journal Gynecologic Oncology by a group of Japanese investigators who evaluated the very important, somewhat controversial and evolving issue of the relative role of chemotherapy versus pelvic radiation therapy in the management of high-risk endometrial cancer. This group of investigators performed a randomized trial involving 385 patients with what has been described as either intermediate or high-risk endometrial cancer. This include women with endometrial cancer with myometrial invasion deeper than 50% of the muscle wall. These patients were randomized again to either receive pelvic radiation therapy or a CAP chemotherapy regimen. There was no statistically significant difference in either progression-free or overall survival in this group of patients. Certainly these data support the argument that in this particular setting, with a high risk of recurrence, progression of endometrial cancer, that a platinum-based chemotherapy regimen, or in this case a platinum adriamycin regimen, is a reasonable alternative to employ rather than pelvic radiation therapy. This is an interesting question. Certainly the debate continues and discussion continues, and I know there will be more studies addressing the point, but this paper certainly is a valuable contribution to the literature and certainly again demonstrates the value of combination chemotherapy in endometrial cancer. Again, this is Dr. Maurie Markman.